Hello, I welcome you all to Healthy Living with Regina Tete, where it is all about health promotion. So, yesterday we began with the patient charter, where we're learning about the patient's rights and responsibilities. If you've watched that video, kudos. I hope you know your rights now. You can't give what you don't have, and you can't demand for what you do not even know you're supposed to demand for. So, kudos if you know your rights now. If you knew it before you watched the video, it's good you refreshed your memory too. Yes. Good. So today we are going to talk about responsibilities. This is something most people do not like to hear, but trust me, for you to be able to rightfully demand for your rights, in a way, you should have actually fulfilled your responsibilities. Okay, so let's say you want to receive the best health care possible, but you come to see your doctor, yet you did not give your doctor then all the necessary information he asked from you. How would you be able to get the best care possible that we mentioned in point one yesterday? That is your right. How would you be able to get that particular care? You won't be able to. So, in my opinion, I think the rights and responsibilities go together for our healthcare as patients. Okay, good. So let me go straight to the point. But before that, let me say I have a few things to say about some of the rights I spoke about yesterday. About point two, that's the second right I listed. I mentioned that the patient is entitled to full information on his or her condition and management and possible risks involved, except in, yes, so that's why I ended on possible risk involved, but there is an exception, except in emergency situations when the patient is unable to make a decision and the need for treatment is urgent. So you heard something like emergency situation. So let me say a patient is brought in the emergency ward and the patient is unconscious, yet this patient requires care. I hope you are following. This patient requires care, and so what this patient's doctor will do is to go ahead and provide the care because the patient is unconscious, and we may not be able to we may not be able to explain all the procedures and all the risk, in that short time to save the patient's life. So the doctor will go ahead, perform the procedure to save the patient's life. Once the patient becomes conscious, then the procedure and everything will be explained to the patient. I hope you understand it. Good. And also about points, um, I think basically that is it. I think that's basically it. That's the addition I wanted to add about yesterday's rights. Let me remind us once again that this information I'm sharing is something we were taught last year. Okay, so we were taught about patients' rights and responsibilities, and then also to the information from the Ghana Health Service YouTube channel. Okay, and then this particular ones I'm reading, okay, is from the nyahomedical.com. So you could go to this site, watch the videos for yourself, or read this for yourself. And if you want more explanation, you could actually watch this video or even read from other places. This is something that most people have spoken about. Yes, so you could read it in other places also to understand more. But I just wanted to know where I took it from, because once again, like I said yesterday, I didn't invent science. I didn't invent these things. So if I'm talking about them as we see in practice, I'll let you know wherever it is I got the information from. If it's from a lecture, I'll let you know it's from a lecture because I'm still a student. Okay, if it's in my opinion, I'll let you know that, in my opinion. Okay, like I just said, that in my opinion, I believe rights goes with responsibilities. Okay, so wherever the information is coming from, I will let you know. Okay, good. So then, straight to our responsibilities. From the nyahomedical.com, the patient should understand that he or she is responsible for his or her own health and should therefore cooperate fully with healthcare providers. And so we are going to list the responsibilities. The patient is responsible for: 1. Providing full and accurate medical history for his or her diagnosis, treatment, counseling, and rehabilitation purposes. You see what I was saying? So you come to see your doctor, okay? And then your doctor asks you all the necessary information that he or she needs. And let me say there is a particular you're supposed to say yes to. But because you are shy or something, you say no. But there's particular information you're supposed to give. Let me just use an example. like maybe information regarding the first time you've ever had sex as a male or the first time you've ever had sex as a female. Your doctor asks you this, and then maybe remember the dates, but you'll be like, oh, you've never had sex before. For all we know, that particular information will help us with the diagnosis. Okay, yes, for both sexes, especially for the females, when it comes to certain infections regarding certain sexually transmitted infections, okay, one like cervical cancer, the likelihood of very young people, okay, very young people contracting the cervical cancer is so high than people who are not so young. Okay, I could say it that way. So let me say someone who is in the early teens begins to have sex at a very early age. Once a person comes into contact with the HPV, it is relatively easy for this individual, this girl, this very young girl, to have cervical cancer as a result of exposure to the particular HPV responsible for causing the cervical cancer. Okay, it's relatively so easy for this individual to contract the cervical cancer than it is for an individual who is way older than her to contract when this individual comes into contact with the HPV. Okay, so they are all at risk of contracting it, but the risk is the risk is increased in the very young individual. So when you come and then your doctor is asking you of the age at which you first had intercourse, you know, let me say this. The questions doctors ask, okay, is vital to help make diagnosis. So if you give us wrong information, the end result, okay, the end diagnosis may end up being different and you'll be treated for a different condition. Okay, because it is whatever information you give and then whatever findings the doctor gets from examination, and then sometimes the investigations is this information the doctor will put together and make diagnosis. So if you eliminate one factor, it is highly likely the diagnosis may also change. So please, whenever we come to see our doctors, please let us provide the full and accurate information. If you do not remember, you tell the doctor, oh, you do not remember. But once you remember, it is for our own good that we remember some of this vital information to give to our doctors to provide us with the necessary health care. Okay, it is very important for the diagnosis to be accurate and for the treatment to also be accurate. If the diagnosis is something else, we may end up treating you for that diagnosis when in fact you probably have some other condition, and then we may go and say that, oh, the doctor, I went to the hospital but the condition hasn't improved, because we'll give all sorts of reasons. We will say we are not feeling better, and it's probably the doctor that didn't do his or her work, and the treatment isn't working, the medication the doctor gave me wasn't effective. Meanwhile, that medication is effective for the diagnosis the doctor got based on the information that you give the doctor. Okay, so please let us give full and accurate medical history for whatever reason for which you came to the hospital. Good. The second one, requesting. Okay, yeah, so the patient is responsible for requesting additional information and or clarification regarding his or her health or treatment which may not have been well understood. Remember yesterday we spoke about your right to information when it comes to you. So you have the right to understand the condition. Okay, so when you come to the hospital, after you give your information to the doctor, you have the right to ask him, oh, so doctor, please, what is wrong with me? You have the right to ask her, doctor, please, what's wrong with me? And he or she will relay the information to you. If whatever he says is something you do not understand so much, it is your responsibility to let him know that, please, I didn't understand. To let her know that, please, I didn't understand. Could you please take it again? So it's like it's your responsibility to understand before you leave that consulting room. So let me say the doctor says something and you do not understand, and then you go and do something else which is probably not what the doctor meant. Okay, so when the doctor says something, to be able to check if you understand, you put it in the way, you say it in the way you understand, not necessarily in the same way the doctor said it. So you paraphrase it, say it according to your understanding, to check if the way you understand it is what the doctor meant to say it. Okay, it's what the doctor meant when he said what he said or when she said whatever it is she said. Okay, so if you don't understand something, please do not hesitate to ask your doctor for explanation. So over here, it is your responsibility. Otherwise, if you go and do something else and it results in something else, the doctor cannot be held responsible. So please, if we do not understand it, let us insist we understand whatever explanation our doctors are giving us before we leave the consulting room. Good. The third one is the responsibility of the patient. Okay, so the patient is responsible for complying with prescribed treatment, reporting adverse effects, and adhering to follow-up requests. The last part especially. Some of us will go to the hospital, will be treated, and our doctors will let us know that, oh, come on this day, come next week for review. We won't go for the review. You see, it's our responsibility. We won't go for the review, for the doctor to check the progression of the condition, know that, oh, it is gone, or we need to check the medication, or we need to do this, we need to do that. We won't go because we may be feeling a little bit better than we were before we went to the hospital. But the harmful thing about this is we are not looking into our system. You see, we can't see into our system to know that the disease is actually gone. And so certain tests, and the doctor will have to ask you some other questions and do some other tests. So please, let us go for these follow-ups. Okay? And also about complying with prescribed treatments. When the doctor says take the medication for 7 days, please let's take it for 7 days. Sometimes after we've taken it for the first 2 days and we are better, we stop. Please, this is not good. Okay, it is not good. Let us follow the prescribed treatment. The more we do not follow this, okay, especially when it comes to the antibiotics, the organism, okay, most bacteria end up building resistance to the antibiotics. That's when we do not complete treatment. That's associated with why we have so many antibiotic resistance when it comes to most of the drugs. So realize that now certain organisms are no longer sensitive to certain antibiotics. Okay, so it's like some of the drugs are no longer working on some of the organisms. Do you get it? So please, let's comply with treatment. And also, when we take the medications, okay, or when we do whatever it is we've been asked to do, and there's been an adverse effect, let us report to the doctor. Let us go back, okay? The medication will be changed. The doctor will ask you certain questions again, do certain tests where necessary to find out if they could change the medication for you. There are lots of medications. So if this one isn't good for you, another one will be good for you. Okay, good. Now the fourth one, the patient is responsible for informing his or her healthcare providers of any anticipated problems in following prescribed treatment or advice. Good. So let me say you are asked to take medication 3 times a day, okay, or 4 times a day. And maybe you are the type that will forget easily. You could let your doctor know that, oh, doctor, this one I may forget easily. Okay, like I said, there are a number of medications. Once it's a medication that the doctor could get another option for you, the doctor will look for one that may be twice a day or three times a day that will still be able to tackle your condition. Okay, so please, once you are foreseeing that this then it may not work for me based on my schedule or something, please communicate it to your doctor. But rather than accepting it and going home and realize that, oh, the doctor says take it 4 times a day or 3 times a day, but you do not take it according to that. And then maybe you decide to take it just twice a day. It may not work as it should. Okay, let's continue.